this topic on regenerative adjuvants in cosmetic gynecology. I am Dr. Deepthi Goswami, and I am the alumni of this prestigious institute, Ilamed. I would like to thank Dr. Bhavna ma'am and Dr. Rana sir for giving me the opportunity to speak on this very important topic. So if you have any doubts or any questions, queries, you may ask at the end of the lecture. So now coming to this topic of regenerative adjuvants in the cosmetic gynae. So from where this concept has come. So the theory behind is that the process of creating living functional tissues to repair or replace tissue or organ function, which is lost due to the age, disease, damage, or congenital defects. And the practice of regenerative medicine is to apply the scientific principles and medical technology to support, augment, or induce tissue healing or growth. So regenerative gynecology is a branch of cosmetic and aesthetic surgery, which comprises of surgical and non-surgical procedures, enhances aesthetic appearance and functionality of vulvovaginal region. Most commonly, women are affected by birthing injuries, uterine prolapse, incontinence issues, vaginal atrophy, genitourinary syndrome of menopause, lichen sclerosis, sexual dysfunction, and vulvovaginal laxity. So these indications not only affect the sexual well-being of the women, but also deteriorates the overall quality of life. And that's how the concept of regenerative gynecology came into being. So what is the importance? The cosmetic gynecology not only wants the women to be beautiful from outside, it also wants you to become more beautiful from inside. So the procedures which are done helps to enable the women to tone up their pelvic floor muscles and regain the integrity of tissues. And also it gives them the opportunity to have or achieve a better quality of life through increased comfort and confidence. So there are various procedures and treatments that are performed in cosmetic gynecology, which can be divided into like surgical procedures, which includes labia manoroplasty, clitoral hoot reduction, hootoplasty, labia majoroplasty, vaginal caliber reduction, monsplasty, vaginoplasty, perineoplasty, and colpoperineoplasty. The minimal invasive procedures, which I would be discussing with you today, is with the platelet-rich plasma therapy and also the lipofilling or the fat graft. And it also includes the energy-based devices like erbium YAG laser therapy, carbon dioxide laser therapy, the radiofrequency monopolar, bipolar, cryogen cooled monopolar, radiofrequency, HIFU, and diode laser. So how and when the PRP in aesthetic gynecology came into being? So the aesthetic practitioners, they have been using this PRP in the regeneration of vaginal mucosa, muscles, and the skin. After PRP injection, it has been found that the vaginal vascularity is increased with subsequent dramatic increase in sensitivity. In addition, the skin becomes thicker, firmer, making the vagina looks much more youthful. Moreover, the ligaments and muscles supporting the urethra, it becomes stronger, alleviating the urinary incontinence. So what is the platelet-rich plasma? We all know that platelets are the cytoplasmic remnants of the megakaryocytes, which are found in the marrow, and they contain 30 important proteins. So of which the 7 growth factors of the proteins are more important. So they contain granules that store large number of growth factors. The alpha granules released, or that means when activated, they are released when the platelets adhere and aggregate to the site of injury or inflammation. These growth factors include the platelet-derived growth factor alpha-alpha, the platelet-derived growth factor beta-beta, the platelet-derived growth factor alpha-beta, the TGF-beta-1, TGF-beta-2, the vascular endothelial growth factor, epithelial growth factor, connective tissue growth factor, insulin-like growth factor. So there are many growth factors which are released when these platelets are activated. So this activation of platelets and the release of various growth factors that makes them special and is the key to enhance tissue repair and healing, as you can see in this diagram. So the platelet-rich plasma is simply the whole blood, which is centrifuged by the method of differential centrifugation to create an increased concentration of plasma platelets with or without the white blood corpuscles. So it could be manually or mechanically, it could be prepared, and manual processing, it allows for better concentration. So as I have have told you that it contains a cocktail of growth factors, of which the 7 growth factors are very important: the VEGF, the fibroblast growth factor, the insulin-like growth factor, the TGF-beta, the PDGF alpha beta, the EGF. So these are the various cocktail of growth factors which the platelets contain. When activated, they are released. In addition to this, they also contain important 3 proteins. These are the vitronectin, the fibronectin, and the fibrin, which are responsible for the adhesions and aggregation. So degranulation of the pre-packed growth factors in the platelet, it occurs on activation, and calcium chloride and calcium gluconate are actually used in 1:10 dilution to make the platelets active. So coming to the different types of PRP, we have 4 main types of PRP, which depends upon the cellular content and fibrin architecture. One is the pure platelet-rich plasma or leukocyte-poor PRP. It doesn't contain any leukocytes and it has a low-density fibrin network after activation. Second is the leukocyte and PRP products. They contain leukocyte and with a low-density fibrin network after activation, and largest number of commercial or experimental systems exist in this family. The third one is the pure platelet-rich fibrin or leukocyte-poor platelet-rich fibrin preparations. They do not contain leukocytes. They have a high-density fibrin network. It only exists in the strongly activated gel form. It cannot be used or injected like traditional fibrin glues. And the fourth one is the leukocyte and platelet-rich fibrin or second-generation PRP products. They contain with the preparations come with the leukocytes and a very high-density fibrin network. So how the PRP is then prepared? So the idea is with the venipuncture, the venous plasma or the blood is collected, and they are with the help of centrifuge machine, we separate the platelets, and then the platelet-rich plasma is extracted and it is returned for the various uses. So this is the preparation. First, the blood is taken from the patient. And usually if we take 30 cc of the blood which is taken by venipuncture, 3 to 5 cc of platelet-rich plasma is obtained from the patient. We use the centrifugation method. The method is differential centrifugation, or the double spin method is used. And the first spin, the soft spin, 1200 RPM for 10 minutes, followed by the hard spin, that is 2400 rod per minute for 10 spin. So in the first spin, we get the upper layer and it is separated into the lower fragment. The blood separation is in the 3 distinct strata. And in the second centrifugation, the platelet concentration or the pellet could be seen at the bottom of the tube. So if we could see in this diagram, so the cellular ratio, if there is a normal blood clot, we see that the platelets are there only in 6%, the WBC 1%, and it is the majority is formed by the RBC. If you see the peripheral blood smear, you can well appreciate. But when we do the concentration of centrifugation, the cellular ratio, it just reverses. The RBC constitute about 5%, 1% is the WBC, and you could see in this pie diagram that the platelets, it increases up to 94%. So that is the beauty of the centrifugation, and with this method, we use the PRP. So the idea of centrifugation is to sequestrate platelets in high concentrations, enough for achieving therapeutic benefit and in a viable state at the same time, so that they can actively secrete their growth factors. Only precautions you have to take is the aseptic condition and optimum temperature regulation and the anticoagulant, that is the acid citrate titers. So what is the mechanism of action? As I have said, that when the platelets are activated, the growth factors are released, and these growth factors, they promote wound healing through the following stages. First is the resolution, then chemotaxis, then cellular regeneration, followed by proliferation and migration, then the extracellular matrix synthesis, there is a remodeling, there is angiogenesis, and there is epithelialization. So this use of PRP it's been used for a long time in orthopedics, in the skin dermatology people they use, in the IVF sector they've used, and now we are coming up in for the vaginal rejuvenation. So it has been a boon to treat alopecia, like androgenic alopecia, alopecia areata, acne scars, for the facial skin rejuvenation, for wound healing, in the orthopedics department, in early cases of osteoarthritis, in tear and in sports in sports, all those sports medicine, this is widely used. So what is the pre-procedure care? So we must know that in aesthetic gynecology, we must take proper procedure care, because if we do not take the pre-procedure care, then the complications may happen, and the procedure may go beyond or against the expectations of the patient. So we must be very careful. We have to assess the concerns of the patient, because we have to know whenever a patient comes to you, what is her concern, for what she is going, or she wants to take PRP. And you check her expectations from the procedure. You have to nicely explain to the patient what she can expect and what could be the results of the procedure. Counseling about the steps of procedure, risks and benefits, when and what effects patient can expect, downtime post-op care, and informed consent. So this is not only for this PRP, as a whole for any regenerative gynecological procedures. Post-procedure care, if or for the face and all, even for the face or even the skin and vagina. So they have to avoid massaging or rubbing the treated area. They have to avoid swimming and gym activities. And if they have used for face, then they have to avoid facial peels or laser treatment for at least 4 weeks and apply a gentle cleanser. And for if they have used the PRP for the face, then they have to use a sunscreen. So contraindications, obviously pregnancy, lactation, persons with active skin diseases, if the patient is on cancer chemotherapy, then abnormal platelet functions, anticoagulant therapy, and underlying sepsis. So mind you, it is always good if you could do the platelet count before the procedure. Then it gives a rough idea that what is the platelet count of the patient and what could you expect after the platelet PRP is taken with the centrifugation method. Then we can have a rough estimate about the amount of platelets which we may get. So the working definition of PRP is that per ml there should be around 1 million of the platelets in the centrifuged sample and the pellet which contains. And if you can if the laboratory is available by the site, we can go for PRP and the post PRP. We can give the report to the patients. Then patients would be also happy that it has been properly centrifuged and the sample was taken very nicely. So coming to the PRP uses in gynecology, as I have already told, that it was in use in various other departments like like orthopedics, in dermatology. Now PRP uses in gynecology for vulvar, cervical lesions, in urogynecology and genital prolapse, in reproductive medicine, aesthetic gynecology, even in obstetrics, and to improve the surgical outcomes. So it has been found that PRP has also been used in the breast reconstruction, the plastic surgery people, and also in the field of aesthetics. They have done some studies, pilot studies, small size sample on animal models, and they have used alone PRP and also with the adipose tissue or the fat tissue for the breast reconstruction. So these are the studies in 2013 where they had enrolled 100 patients between 19 to 60 years, which were affected by the breast tissue soft tissue defects, and they divided the patients into 2 groups. The study group was treated with fat grafting plus PRP, and the control group was treated alone with the fat grafting injection. And they found that the patients treated with PRP added to the autologous fat graft showed a 69% maintenance of counter restoring end of 3-dimensional volume after 1 year, whereas patients of the control group treated with centrifuge fat grafting showed a 39% maintenance. So you could see such a good result when the PRP was used with the fat grafts. They concluded that the PRP mixed with fat graft leads to an improvement in maintaining breast volume in patients affected by breast soft tissue defect. So coming to the use of PRP in fact female sexual dysfunction, medical professionals, they know that platelets, they release around 35 growth factors, 30 mainly growth factors and other 3 proteins. So the 35 growth factors, they help in promoting the tissue regrowth, healing and regeneration. So this fact was utilized by aesthetic gynecologists in many aspects, including vaginal rejuvenation and O-shot therapy. You must have heard about the O-shot therapy, and I think you must have heard about the P-shots and O-shot therapy, which are very much in talk. So the PRP in the female sexual dysfunction, that is the O-shot therapy. So The use in sexual dysfunction is considered a revolutionary new non-surgical office treatment that helps in sexual dysfunction through using women's own growth factors. It is injected into the specific areas of the vagina and around the clitoral area with the aid of local anesthetic cream. We all know that a female orgasm is two types of orgasm. One is vaginal and one is clitoral. So the oat shot therapy, it increases the clitoral orgasm, so it really increases their sexual gratification, or the sexual orgasm is very much increased with this modality of treatment, because it immediately activates tissue regeneration and the enhancement in sexual response is dramatic. The desired response includes improved arousal, stronger orgasm. There is a decrease in dyspareunia, and it increases the natural lubrication. So very, very useful in perimenopausal and the menopausal age group also. So there has been many studies, and Runnels et al. 2014, he enrolled 11 female patients presenting with dyspareunia in their study, and they injected PRP into the clitoris and the vagina, and they found that intravaginal and intraclitoral PRP injections could be an effective method to treat certain types of female sexual dysfunction, especially in the areas of desire, arousal, lubrication, and orgasm. This is the effect of the PRP. And for the vaginal rejuvenation, aesthetic practitioners, they use the PRP in the regeneration of the vaginal mucosa, muscles, and the skin. It has been found that when the PRP is injected, the vaginal vascularity is increased with subsequent dramatic increase in the sensitivity. The skin becomes thicker, firmer, making vagina looks more youthful. Moreover, ligaments and muscles supporting the urethra becomes more stronger, alleviating urinary incontinence. So patients with stress incontinence are largely we have seen improvement with the PRP in patients with the stress incontinence when the PRP was used. So Kim et al. In 2017, he reported the use of PRP in one case of vaginal rejuvenation. So minded, there has not been a very big study. So these are the small studies that have been done, and they have reported the use of PRP and their results. So they concluded that the application of autologous lipofilling mixed with PRP in vaginal atrophy, they produce relief of symptoms and counter restoration. So rejuvenated appearance of external genitalia, they provided a pleasing cosmetic outcome to the patient. So what are the then adverse effects of PRP? The PRP adverse effects are the patient can feel pain. There could be redness, swelling, bruising, burning sensation could be there, but that can be reduced by staying in cold, avoiding activities with increased sweat production, and sometimes usually mild headaches which respond to mild analgesics, very rarely cellulitis or skin infections. And all these complications could be avoided if there is a strict asepsis is maintained while doing these procedures. So as we have come to the advantages of PRP, we all know that it is an autologous because your own blood is taken. So the patient never refuses such type of treatment if the proper counseling is done. And it has got a tremendous results because of those growth factors which are released in tissue regeneration and rejuvenation. They are very safe because of autologous. They are non-allergenic. They are free from concerns over transmissible diseases such as HIV, hepatitis B, C, and so on. And there is a faster healing. There is no fibrosis formation compared to long-term fillers, for example. Very easy to use. Dermal and hypodermal injections require only one syringe and needle. Convenience that it can be easily and quickly performed in your clinic. A sterile and registered specific kit for the blood puncture, preparation of plasma, and materials are used, and very, very cost-effective. So there is another study, a novel technique of vulvovaginal rejuvenation by lipofilling and injection of combined platelet-rich plasma and hyaluronic acid, and the case report. And the conclusion was that it is very safe and easy to perform, and very effective, and the patient satisfaction was very good. So to summarize, a substantial rise in technological advancements to reverse age-related tissue modeling and for tissue functional restoration, The implementation of these new modalities for vaginal rejuvenation has opened up a new dimension to explore cosmetic indications in conventional gynecology. The social acceptance and the formation of regulatory bodies for better practice of these procedures is long overdue. However, looking ahead, this field has emerged to improve the quality of life of the patients. With this field rapidly evolving, it is vital for standardized procedures to come into place for a safer practice. Hence, long-term studies are required to understand the outcome of the procedures and to validate the treatment using the novel approaches in this field. Thank you very much. I just want you all to go through this video that growing old is mandatory, but staying young is our choice. Thank you very much for your kind hearing. Hello.
Yes, ma'am.
Good evening. Good evening, Bhavna ma'am.
Hi, Dr. Deepti.
Yeah, hello, Pooja.
Pooja,
How are you?
hi. Thank you so much for your precious time and sharing this information with us. And and thank you so much, all of you. You joined this session. And today, in fact, right now, we are doing one cosmetic gynae session right now in Delhi also. So along with me, Dr. Bhavna ma'am, she's here itself. So I would like to introduce ma'am also to you. Just one second. Just one second, please.
Hello, Dr. Dipti. It's so
Hello,
nice
ma'am.
to have you here. Actually, I wanted to introduce you in the beginning, but there was some technical flaw. We were not getting unmuted. So I'm sorry for that. You had to start, but it is so nice to hear you and what
Thank you
better
so much,
for a
ma'am.
mentor can be that seeing a student rise to this level. So
Yeah,
it's
thank you
really
so much,
great.
ma'am. Because of you all that I was able to, could speak and could represent as an alumni of Willamette, could represent at Ranchi also and got invited in All India, obstetrics and gynecological
Looking
conference
forward to see
also.
you there. Yes.
Yeah, but because of my daughter's exam, would not be able to do. But
Okay.
really, thank you. And I really want to thank you, ma'am, Rana sir, and also Ilamed, Pooja, always being there to help me in every possible way. Thank you so much, ma'am. Ma'am, I hope I did justice to the topic
Yes,
PRP.
beautifully. You have covered very, very beautifully the topic, and PRP is very much in vogue. So it is a very good add-on to the tools because it is very easy. You can implement in your clinics. It is for everyone's hands. Then everyone can learn that and do that very easily without a belief that cosmetic gynae is an expensive thing. So PRP is an exception to that. So we very beautifully covered all indications. I think we can take up questions if anybody has. If you have any questions, please write in the chat box or you can let us know. Can't see right now anything in the chat box. But actually you told so beautifully, so I think that is why the students are not confused about it. And they had a very good flow, what PRP is and what indications we can use. You did it real justice to the topic.
Yeah,
that was
thank
really
you so
amazing
much,
to hear you.
Yeah, ma'am. And of course, you would be taking those practical classes, so their concept would be absolutely clear.
Yeah. So just to brief that, we at Ilamed are conducting master's, diploma, and fellowship courses for for cosmetic gynecology, and the courses run throughout the year. Our head office is at Delhi, So anytime if you feel like, you can get in touch with us for the courses. Right now we are having our fellowship batch going on, which is going to finish on 24th. So here's a question in chat box. Dr. Deepti, would you like to answer? At what intervals can we perform PRP? At what intervals can we perform PRP?
So first of all, the assessment is very important. Whenever you give the PRP, you have to know about, the indication of the PRP for which you are giving, and the results usually minimum gap should be around 3 to 4 weeks. And after that, you can repeat the sessions, but you have to know for what purpose you are giving, like for vaginal rejuvenations and all those things, you can give at an interval of 3 to 4 weeks. Ma'am, would you like to add anything else?
Yeah, definitely. You are absolutely correct. You are absolutely correct that it is because of what indication you are giving. So accordingly, you can give, but of course, 3 to 4 weeks is a good amount of gap between the two, because when you inject, the effect also starts coming. The collagen starts developing. So to see a full effect, you need at least 3 weeks time. Okay, because initially there will be some effect, but then PRP gets absorbed and then the new collagen and vessels they form. So they take at least 3 weeks to develop. So to get a idea that what you have to do in a next sitting or how many sittings are required, it generally requires a wait period of 3 to 4 weeks. So very absolutely answered. Can we apply any surface anesthesia before procedure for skin? Yes, we do apply numbing creams. But for vaginal rejuvenation, vaginal mucosa does not require any applications. Okay, so how many tubes required? Depending upon how much PRP you require. For every 10 ml blood, you can get around 1.5 to 2 ml of PRP. If you incorporate some platelet poor plasma also. Which tube specifically? All the tubes which have ACD, they work pretty well. So can we take sample in ED vial? No.
No. Yes.
No. Big no.
The samples are collected in the ACT vial because we do not want the platelets to get activated beforehand. We want it once they're injected into the tissues, then only we want to get it activated. So the whole procedure takes around 1 hour time approximately from the patient's collection and all those things, but we have to maintain total asepsis, and your centrifuge machine and the patient should be nearby. It's not that you're wasting the time. Once it gets activated, then the effect may be gone. So the proper vial, the temperature, the centrifuge machine, and the total asepsis has to be maintained whenever you do the procedure.
Yeah, very aptly you point out the very important points. Can we preserve PRP? No, we can't. Also, could we also do GFC instead of PRP? GFC doesn't have much role in rejuvenation, but of course, if you are working on endometrium, then people are already using GFC. What protocols in vagina? So it is basically injected in mucosa, and there are specific techniques which we practice hands-on when we do our on-site training sessions. Do we inject exactly? GFC are the synthetic growth factors, while PRP is something which you are deriving from blood. GFC is completely synthetic. And that is only one type of growth factor. For vaginal rejuvenation, we inject this into the vaginal mucosa at various sites. Any number of units you can use in one sitting, no limitation, as much as you require. PRP is something which is derived from your patient's blood, so it is absolutely safe. Fine. It's good to have such an interactive audience here.
Yeah.
Nice. Yeah.
Ma'am, lot of participants today I've seen 138, which is so good to see. Yeah.
Any age you can use PRP. You can use in young women, you can use in premenopausal, postmenopausal, depending on what indication you are using. Regarding P-shot, it is a part of, yes, PRP for male sexual dysfunction is a part of andrology. So andrologist takes up those sessions. You are welcome for the fellowship. And in that we include male sexual dysfunction as well. Does it have any effect? Brightening effects, of course. Yes, there are brightening effects. Help with the elasticity of the area. Yes, it builds new collagen. So overall tissue repair and regeneration does happen. Good. It was really good. Amazing session and amazing audience. How much time we can see results? So I told you it is, Dr. Deepti, would you like to answer how many times we can, in how much time?
See,
we can see results?
regarding the
And for how much time
vaginal, vaginal rejuvenation and all those things, the best person who will give you the answer is the patient herself. You know, whenever a patient comes with the dryness of the vagina or this thing, so it is the best the patient will ask. The maximum results which you can see is after 3 to 4 weeks, where you can see the increased vascularity and the rugosity again coming up. Especially this is appreciated more in the perimenopausal and the menopausal age group. Regarding the O shots and all those things, whenever if you ask the patients with female sexual dysfunction, you have to carefully take the pre-O shot history, and after giving the PRP, you can evaluate the patient after 3 weeks, and she will definitely say her, you know, the intensity and the increase in the sexual orgasms and sexual satisfaction is much, much greater in these patients. So the patient's history is very important in such cases because you have to take proper history, and the results, obviously, the patients are the best examples to give you the treatment results.
How many sessions required? So it is depends on indications, as Dr. Deepti already said, that your patient will give you the idea how much sessions are required as she is getting better. So accordingly, it is depending on different indications, different protocols, different session numbers, and these all things are.
Anyone else?
I think all the questions are over. You're welcome, Dr. Jyoti. Thank you. Thank you for joining. We really enjoyed having interactive session. Okay, so keep in touch. We'll be planning more some live sessions. Is there any minimum number of sessions required? Usually at least 2 or 3 sessions are generally required. Thank you, Dr. Shanti. Thank you for joining. Thank you. Thank you. I hope you all enjoyed session. And again, thanks to Dr. Deepti for sparing her time and being here with us.
Thank you so much, ma'am.
Yeah.
Thanks. It was a pleasure interacting with you all.
Yes, all these topics will be covered in fellowship course. Yes, definitely. Definitely. Yeah. Thank you. Thank you. So shall we finish? Okay. Bye-bye and hope to see you all again. Keep in touch. We'll be conducting more sessions. And thank you, Deepti.
Thank you so much, ma'am.
Yeah,
thank you, everyone.
Thank you. Bye.